Hello, my people. Welcome to GOC Grace channel. We are here once again to dig deep into one of the health conditions known as chronic obstructive pulmonary disease (COPD). It's that time again to explore more about our body. Let's just take a few minutes to take control of our health and well-being. Be attentive. Chronic obstructive pulmonary disease. COPD is a progressive, long-term lung disease that makes it difficult to breathe. It primarily includes two main conditions: chronic bronchitis and emphysema, which often occur together. COPD causes narrowing and damaging of the airways, making airflow in and out of the lungs restricted and inefficient. It is one of the leading causes of illness and death worldwide and is considered a major public health problem. Causes of COPD. The main cause of COPD is long-term exposure to lung irritants that damage the airways and air sacs alveoli. The major contributors include cigarette smoking, the single biggest risk factor for COPD. Around 85–90% of COPD cases are related to smoking. Long-term exposure to air pollutants, industrial fumes, dust, chemical vapors, and environmental pollutants can contribute to COPD. Indoor air pollution, smoke from cooking fuels, wood, charcoal, kerosene, in poorly ventilated homes is a significant cause, especially in developing countries. Genetics. A rare genetic condition called alpha-1 antitrypsin deficiency can lead to COPD, even in non-smokers. Recurrent respiratory infections in childhood. These can damage developing lungs, making them more vulnerable later in life. Pathophysiology. What happens in the lungs (:) in COPD? The airways and tiny air sacs in the lungs undergo several harmful changes. 1. Chronic bronchitis. The airways are inflamed and swollen. Mucus-producing glands enlarge, resulting in excessive mucus phlegm. This leads to frequent cough and difficulty clearing mucus. 2. Emphysema. The walls of the alveoli, tiny air sacs, are damaged, reducing the surface area for gas exchange. This makes it harder for oxygen to get into the blood and for carbon dioxide to leave. The lungs lose elasticity, making it harder to push air out. 3. Airflow limitation. The combination of inflammation, mucus buildup, and loss of lung elasticity narrows the airways, trapping air inside the lungs and causing shortness of breath. Symptoms of COPD. COPD symptoms often develop slowly and worsen over time. Early symptoms may be mild and ignored until significant lung damage has occurred. Chronic cough, often referred to as smoker's cough, excess mucus sputum production, shortness of breath, dyspnea, especially during physical activity, wheezing, whistling sound when breathing, chest tightness, frequent respiratory infections, fatigue due to low oxygen levels, weight loss seen in advanced COPD due to energy spent on breathing. Complications of COPD. If not properly managed, COPD can lead to frequent lung infections, pneumonia, bronchitis, acute exacerbations, sudden worsening of symptoms, pulmonary hypertension, high blood pressure in the lungs, right-sided heart failure, cor pulmonale, respiratory failure, when the lungs can no longer supply enough oxygen, reduced quality of life, limited ability to work, exercise, or carry out daily activities. Diagnosis of COPD. Diagnosis is based on symptoms, history, and specific tests. Medical history, smoking history, occupational exposure, family history, physical exam, listening to lung sounds, looking for signs of labored breathing. Spirometry, the gold standard test, measures how much air you can exhale and how quickly. Chest X-ray, CT scan, to look for lung damage or rule out other diseases. Arterial blood gas test, measures oxygen and carbon dioxide levels in the blood. Alpha-1 antitrypsin test, if COPD is suspected in a non-smoker or in younger patients. Management and treatment of COPD. While COPD cannot be cured, It can be effectively managed to reduce symptoms, slow progression, and improve quality of life. 1. Lifestyle modifications. Smoking cessation. The most important step to prevent further lung damage, avoiding exposure to pollutants, dust, fumes, secondhand smoke. Healthy diet, nutritious food to maintain body weight and muscle strength, regular exercise. Pulmonary rehabilitation programs can improve lung function and stamina. 2. Medications, bronchodilators, inhaled medicines that relax airway muscles, for example, short-acting or long-acting beta agonists, anticholinergics, inhaled corticosteroids, reduce airway inflammation. Combination inhalers contain both bronchodilators and steroids for better control. Phosphodiesterase 4 inhibitors for severe COPD with chronic bronchitis, antibiotics for bacterial infections during flare-ups. 3. Oxygen therapy. For patients with very low blood oxygen levels, long-term oxygen therapy improves survival and quality of life. 4. Pulmonary rehabilitation. A structured program that combines education, exercise training, breathing techniques, and psychological support. 5. Surgical options for severe COPD. Lung volume reduction surgery. Removing damaged parts of the lung to improve breathing. Lung transplantation. For very advanced cases where other treatments fail. Prevention of COPD. Quit smoking early and avoid secondhand smoke. Use protective masks if exposed to dust, fumes, or chemicals at work. Improve indoor air quality. Ensure proper ventilation when cooking with biomass fuels. Get vaccinated. Annual flu shot and pneumococcal vaccine. To prevent infections, regular checkups, early detection leads to better management. Prognosis. COPD is a chronic condition that progressively worsens, but with proper treatment, many patients can live active lives for years. The outlook depends on stage of COPD at diagnosis measured by lung function, smoking cessation status, frequency of flare-ups, presence of other illnesses, heart disease, diabetes. Always remember that it's okay to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask. Please like the post, share and comment.